I can really only speak to Michigan, but funding for behavioral health in Michigan is at an absolute historical low. A lot of citizens who require mental health services do not have easy access to behavioral health. Their most easy access is dialing 911. So we're really overtaxing the EMS system, especially in Southeast Michigan, because we really have no other destination by protocol other than to take those patients to an emergency room presently. Michigan is looking at developing a standardized curriculum for doing community paramedic. They definitely want to approach the state legislature in order to identify funding opportunities that can be implemented statewide with any EMS system. We gather a vast amount of data, and ESO helps us take data and use it in a meaningful way.
The new ET3 program that the federal government, CMS, is considering launching, I believe it's triage, treatment, and transport, that will allow funding for EMS, fire, and ambulance to take patients to alternative destinations and receive compensation is going to be crucial, and ESO is going to play a big role in that, because I'm sure CMS is going to want to look at our response data and patient outcome data when they determine who they're going to pay and what they're going to pay for.
A good example would be our critical care transport program. We move a number of patients who require mechanical ventilation. So we document who those patients are, what facilities they're coming from, how frequently we do that. We also know that there's a cost involved in training those folks and acquiring that equipment. And combining all those three data elements allows us to make a pretty strong case on why we need to get reimbursed for that type of work.
Our hospitals are very busy. We're overloading them with patients. One of our regional community medical centers, EMS represents just over 20% of their ED patient flow. And we have occasions where we'll have 5 or 6, maybe up to 9 units hanging on the wall because they have no beds for the patient. They're boarding patients in the ED for the medical floor because the hospital's at full capacity. Using ESO and our patient transfer information from when our providers transfer care to the ED staff helps their administrators make the argument for increased bed counts and increased staffing. And that is one of the best examples how we're using ESO and HDE to improve patient care and also get our units back on the street to serve our public.